study has found that certain macronutrients to be associated with higher risk of type 2 diabetes, and those macronutrients are free sugar, starch, and animal protein. So people at risk of diabetes and have a high intake of these macronutrients should consider replacing those with other macronutrients, such as non-free sugar and plant protein. I'm Fred Toh, a senior lecturer of public health in the University of Glasgow. My work is equivalent to an associate professor in the American system. And the article is entitled Non-Linear Association and Isocaloric Substitution of Macronutrients with Incident Type 2 Diabetes. There are lots of research done on macronutrient and type 2 diabetes risk, but many of them suffer from methodological limitations. The first important one is the lack of fine categories of macronutrients. For example, free versus non-free sugar and plant versus animal protein. So free sugar included any added sugar, so any additional sugar added to the food or beverages, and sugar found in honey, syrup, and juices. And these free sugar are special or different from non-free sugar because they are not enclosed by cell wall of the food or beverages, so the absorption or metabolism of this free sugar have been hypothesized to be different. And indeed, we found these free sugar to be associated with higher risk. And the other limitation is that the older study often assumed the health risk, for example, type 2 diabetes, to be directly proportional to the intake, which is often not true, because we found that even by common sense, the consumption in moderation rather than have more protein as much as possible. So noting this limitation in older study, we have used over 170,000 people stated from the UK Biobank with a prospective follow-up of 11 years to examine this problem. We found that high risk of type 2 diabetes to be observed in people with higher intake of free sugar, especially those who consume at least 12% of the total energy due to free sugar. Starch, those only consuming at least 1/4 of the energy from starch, and animal protein. Also, the study has found that type 2 diabetes were less found in people with non-free sugar intake, omega-3 and omega-6 polyunsaturated fat, and plant protein. And these are what we would hypothesize to be what they call good macronutrients, only because they potentially, at a certain level, they're associated with better or lower type 2 diabetes risk. And therefore, we found that replacing free sugar, starch, and animal protein with non-free sugar or plant protein to be associated with at least 10% lower risk in type 2 diabetes. So the study firstly reinforced what we know about good or bad macronutrients, but I'll put an asterisk on the good and bad at this moment because it's actually more complex than that. But in general, we found that free or added sugar to be generally bad, but replacing with healthier fats or protein sometimes could also be associated with higher risk. So in the replacement of bad macronutrient, we need to observe what we're replacing it with. Instead, we found that if it was replaced by non-free sugar, there doesn't to be an increase in risk no matter how much replacement was done. It also means that the relationship between different macronutrients that replacement are extremely complex. Firstly, we need to observe what are the current intake. So if the current intake is already quite low, that might not be necessary to replace. And secondly, we need to see what to replace the potentially harmful macronutrients. And these are the nuances, I think, very useful for clinicians providing nutritional consultations. And we need to get beyond the thinking of something like carbs are bad and proteins are good, that kind of thinking, because it's too simplistic, too reductionist. Some carbs are okay, some carbs are particularly bad, and some proteins are fine, like plant protein, and some animal protein might not be necessarily good. And we need to observe this kind of simple reductionist message is not really helpful. Weight management is still the key for controlling or reducing risk for type 2 diabetes. We know that obesity is still one of the strongest risk factors for type 2 diabetes. And if someone is currently overweight, changing just the composition of macronutrients or nutritional intake won't do much. However, if someone is already in a healthy weight range or working towards it, changing the composition of macronutrients could be a good additional health step to achieve better health. For example, cutting down highly processed food could be a good start because many of them include a large amount of added sugar, starch, and animal protein. For example, replacing soda or fruit juice with actual fruits and water could be an option. Also, if someone is not having an excessive amount of starch, that might not be necessary to cut it down. Importantly, if someone needs to replace starch, beans and legumes could be a good option because they contain a large amount of plant protein. But meat might not be because they primarily are animal protein. And these could be a very complicated compared to the usual nutritional advice that you see in the traditional or social media. So if you're in depth, talk to a nutritional professional who are up to date with the latest science. These findings are observational, and it's only from one study in the UK, which means it might not necessarily be as applicable to other populations, especially in a population with very different dietary culture, for example, Asia. So replication in our population to see whether there's differences by country or dietary culture would be very interesting. In addition, interventions to implement these findings will be very useful as well, because we need to see how these findings could be translated and replicated in the real world in terms of dietary interventions.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.